Did you know that you can actually intubate someone through their nose? It makes sense, right? I mean, your nose, your mouth, your lungs, everything's all connected. Nasal intubations aren't typically the norm for most patients. I've actually only seen a nasal intubation maybe 2 or 3 times in my ICU career. And that was because the patient had some sort of oral trauma that was preventing them from being intubated orally. I've also seen patients that have had large tumors or masses that are constricting something in the oral airway, and so they will try the nasal airway as well. It can be common for nasal intubations for different procedures, especially for patients that need some sort of oral procedures. They'll have better access to the mouth if the patient is nasally intubated. They don't recommend nasal intubation in patients with a lot of facial trauma or a possible basal skull fracture. That's because you're worried about direct cerebral injury or infection. The nasal passageway is also a very small passageway compared to the oral passageway, and so you need a tinier tube, which means more risk for that tube getting clogged or kinked off. I'm curious if you've ever seen a nasal intubation. What type of patient did you see this in? And let me know how it went.